Funding for this edition of One-on-One with Steve Adubato has been provided by the Turrell Fund, supporting Right from the Start NJ, the Robert Wood Johnson Foundation, Horizon Blue Cross Blue Shield of New Jersey, TD Bank, Summit City MD, a provider of primary, specialty, and urgent care, the Healthcare Foundation of New Jersey, New Jersey Sharing Network, Gibbons PC, and by the Fidelco Group. Promotional support provided by ROINJ, informing and connecting businesses in New Jersey, and by the New Jersey Business and Industry Association.
This is One-on-One.
I'm an equal American just like you are.
The jobs of tomorrow are not the jobs of yesterday.
Look at this. You got this?
Here it is, man. Look at that.
Life without dance is boring.
I don't care how good you are or how good you think you are, there is always something to learn.
Do you enjoy talking politics?
No.
People call me because they feel nobody's paying attention.
Our culture, I don't think, has ever been tested the way it's being tested right now.
Such a good question. High five.
Steve Adubato here. I want to just acknowledge that recently my co-host and the executive producer of our series that we do called Lessons in Leadership, we had the chance to sit down with Michellene Davis, who's a great leader and also the Vice President and Chief Corporate Affairs Officer at RWJBarnabas Health. Mary and I spoke with Michellene about a whole range of issues having to do with race, COVID-19, gender equity issues, whole range of important issues. We thought the conversation was so important, even though it was on Lessons in Leadership, we thought it would work really well here as well. Michellene Davis. Welcome back to Lessons in Leadership. I'm Steve Adubato. That is, you'll see her on camera, my co-host and executive producer of the series, Mary Gamba. And Mary will continue to be joined. We continue to have Michellene Davis, who is in fact the Executive Vice President and Chief Corporate Affairs Officer, RWJBarnabas Health. Michellene, let's shift gears. I want to talk about something that you and I talk about a lot offline. You've written about this. You've been published on this. How could it be that so many people of color are disproportionately, based on the population, getting sick and dying from COVID-19? Why is that happening?
So, Steve, thank you for the question and for paying attention to the topic. I think that the national discussion has turned in this direction, but those of us who have been really fighting to reduce and indeed eliminate healthcare disparities for some time are not surprised. This is literally not something that is happening episodically. It is really the accumulation of systemic and structural issues that have existed for decades really just coming to bear right now. And so as a result of that, what you see is the fact that these individuals, many of whom already either grew up in and or currently reside in densely populated urban environments, really are those who have long-term suffered with chronic health issues. But those chronic health issues have been contributed to as a result of their environments, as well as just systemic and structural, quite frankly, policies and zoning, i.e. redlining, et cetera, that have really contributed to their outcomes.
Michellene, sorry for interrupting. Are we talking about the social determinants of health? Is that what we're talking about?
We are, Steve. Thank you very much for
You've taught us well.
So as you know, the social determinants of health are those things which really impact your health outcomes that are outside of just your visit to a doctor's office. So where you live, whether or not it's a safe neighborhood and safe environment, whether or not you live in safe and affordable housing, or are you literally living in a space that has issues that really come from mold, et cetera, whether or not your air is pollution free, or whether or not you live in one of the communities I just mentioned, that as a result of historical and intentional zoning and redlining winds up being in an environment where others who primarily look the same reside, but then akin to that, right, within that environment, you also have a tendency to see higher industrial plants, right? So then you'd have the counties Garbage incinerator would be there, a tire factory, a cement factory, and all those things tend to also be co-located within these environments.
Does COVID-19 exacerbate these issues, these health issues?
Absolutely. You know, Steve, someone called it the great equalizer. And I understand their intent. I believe it was well intended. And really that was made in order to show that no one can be educated out of literally having COVID-19. No one can be wealthy enough so that you're no longer within that risk pool. But the issue truly is that it is not. It is just a great magnifier. What it is magnifying is the fact that we are all intricately intertwined, that what happens to the least of these, right, can also happen to the most of these. What it evidences, what it shows is the fact that all of a sudden we have a world that has been held up by the essential workers who make the least, and that these historical disparities, that the structural and systemic inequity that we're talking about has always existed, again by design, and that as a result, if we do not do something to address it now, after we can no longer say that we don't see it or we didn't know it was there.
It's clear.
Right? That not only will those communities be impacted, but every other community as well.
So listen, Mary, I want you to come back in here because disclose a couple of things. And I want to continue this discussion about these disparities and also about some male-female gender issues as well.
Sure.
Michelene's been a leader in this regard as well, but I want to disclose that RWJBarnabas Health is an underwriter of our public broadcasting programming, and also Michellene is on the board of our not-for-profit organization, the Caucus Educational Corporation. Mary, follow up because I could see how engaged you are.
Thank you. Yeah. And Michellene, thank you so much for sharing. I think you're opening up a lot of people, our viewers' eyes on what the issue is. And in terms of a lot of times you'll, in reading about this, some people will say, oh, well, high risk people of color, they should shelter at home. Why don't they just do that? What do you say to those people in those situations? Because, it seems easy enough, shelter at home, but why is that not a real possibility?
Yeah, so thank you, Mary, for that question. I always, I think the people who are concerned enough about reminding us that that's the mandate, that's the order, that's what they should do. And then I look at them like two things. One, and how would you eat? Because the individuals who are stocking your shelves every day, who are driving your trucks every day, that the individuals who are delivering your food every day, who literally are picking up your garbage, right? What would your community look like then, right? So two things. One, that's a point of privilege, right? So you are looking at that situation through a lens of your privilege, which is not, quite frankly, appreciative of the fact that that is not where everyone is, right?
And a lack of empathy.
Indeed, my friend, a lack of empathy and so much less no compassion at all. So one of the additional elements there is also the fact that, shelter in place is not necessarily the same for all. It's one thing when in fact you are sheltering in place and you can be socially distancing within your home. But for those who live in multi-unit dwellings, sheltering at place does not necessarily mean that you are also socially isolated, right? I get on an elevator to a building that it has 20 stories and a public housing unit. I'm not certain that is socially distancing. It doesn't actually accomplish quite the same things. I live in a multifamily unit with several generations of families. They're in and out. So I just want to make certain that people are aware that that looks different for everybody else. It's not just that I can stay at home and not worry about it. There are still issues that I need to actually address if in fact I am there. The other side of that is, right, in order to come and stock your shelves, I had to take 2 buses to get there.
True.
And that bus is crowded.
Every time.
Every time. And if you then say, we're only going to let the bus or have the bus be 1/3 full of people, that means you don't have that bus. You can't get to work. I mean, what Michellene has taught us over the years in many, many conversations on the air, but mostly off, is that that transportation is a social determinant of health. Yeah. Economics, housing, all kinds of issues. But how many of us are sitting there thinking, well, I'm going to be safe, so I'm not going to get on that bus. that bus is the only way you get to work and feed your family. Go ahead, Michellene.
So I think that that's exactly right, Steve. And I think that there are many individuals who have been given the wonderful grace and opportunity this lifetime to not experience what those harsh realities are. Listen, I am a caretaker of a mother who I adore, who is an elderly woman with Alzheimer's, who has had a heart attack and a stroke within 6 months of each other this year alone. In the very beginning of this, I had to make the decision to send her aides home because while they are lovely, they take public transportation in order to get to the house, in order to care for her. They live in multi-family dwellings with multi-generational family members. And so as a result of that, the element of risk is so much higher because exposure to even one person increases that much more.
Just to switch gears very quickly, and I know we won't totally get into it, but
You can do gender a little bit?
Yeah, I do.
Go ahead.
And Michellene, you have spoken about and written about gender equity. Really, how has COVID impacted it in a 1-minute snapshot? What is happening?
So as COVID had been the great magnifier on other issues pertaining to disparities in Black and Brown communities, COVID-19 has also been an incredible magnifier about why it is so incredibly important and why it is such a dire need in order for us to actually achieve pay equity here, right? So take, for example, the impact that we're seeing on Black and Brown communities alone. Add to that the fact that what we are seeing is actually African-American men and Latino men dying at even a faster rate in this faster dying and more frequently perishing community. So we have all of these households which now have lost that dual income as well as having lost a loved one. So as a result of that, imagine for a moment that you have the women who are in these households, many of whom, actually 80% of which, if you combine all communities, are actually female-headed households anyway, right? Add to that the issue of pay inequity. So we know that white women, my sisters, make 82 cents to every one white male dollar. We know that African American women make upwards of 65 cents, right? And then Latina women, our sisters, are at 62 cents. Wow. So take a look at what that means given this pandemic and the extension of what many of our states are under right now as to literally a shelter-in-place order. And we have families that are going to be going without economic income for a significant period of time. And then, quite frankly, on the other side of that, will never be able to truly make up for what they've lost. But even had it not occurred, they were always at a disadvantage. And then we wonder why these communities can't just stand up by their own bootstraps. Well, it's because they have literally put on the bootstraps of others and not been paid for the ones that they've been building all the while.
Michellene has laid out so many important issues, questions, and we don't delude ourselves into thinking we have answered them, but she's put them on the table. I promise you the conversation will continue. I just want to say thank you, Michellene, for joining us. Best to you, best to your mom, best to the people on the front lines at RWJBarnabas Health and all of the hospitals and hospital systems we work with those, the term heroes getting thrown around a lot, and it could never be more appropriate than it is right now for those doctors, nurses, respiratory therapists, technicians, all of them. Michellene, thank you so much for being with us.
Thank you, Steve. Thank you, Mary.
Thank you.
This is Steve Adubato. That's Mary Gamba. That is Michellene Davis. Catch you next time.
To watch more one-on-one with Steve Adubato, find us online and follow us on social media.
Recently, I had the opportunity on a series we do called Lessons in Leadership with my co-host and the executive producer of that series, Mary Gamba. We sat down and we spoke with Dr. Maurice Elias, who is a professor of psychology at Rutgers University. We talked about emotional intelligence and leadership, but we also talked about the fear and anxiety so many people are experiencing in the age of COVID-19, and also how to talk to our kids, teenagers, younger kids, and frankly, how to deal from a mental health point of view with this incredibly challenging situation. This is Dr. Maurice Elias. Hi, this is Steve Adubato. Welcome to Lessons in Leadership. This situation, the COVID-19 crisis, if you will, the pandemic, is not stopping us from producing important programming about leadership, about communication, frankly, dealing with these most difficult times for all of us. And don't get turned off or thrown off by the word leader and say, well, I'm not a leader. That's not me. Well, tell you what, I'm betting you're the leader of your house, or there are other leaders in your home, and you're dealing with a whole range of issues at home: decision-making, communication, management, anxiety, all those issues, keeping people positive and upbeat, but at the same time dealing with this reality. I don't know how much different that is from dealing in the workplace. In many ways, the family is a microcosm of the workplace. And in that spirit, I want to introduce our executive producer of Lessons in Leadership, the co-host of this program, my colleague, Mary Gamba. How you doing, Mary?
I'm doing really great, Steve. I'm excited to be doing this Zoom interview in this format. Obviously, as you said, these are really challenging times, but it has caused us all to adapt, to reinvent, and to be strategically agile. So I'm looking forward to having a great conversation today.
You know what's interesting about this, and by the way, to Frank and Elvin and everyone who's behind the scenes making this happen, as well as our son, Nick, who's off camera, if you do not have a 17-year-old who understands technology, you're in trouble. We do. We're lucky that way. But in that spirit, I just want to make it clear that we could talk about leadership, and here are the best practices, and here are the 5 things you need to do. But on another level, all of us who are leaders of for-profits, not-for-profits, educational institutions, churches, government, there's an emotional side to this. There's a psychological side to this. It's personal for a lot of us, if not all of us. In that spirit, when it comes to these kinds of issues, you reach out for people who know better than you do, which is an important leadership trait. Know what you know what you don't know, and figure out who knows what you don't. And in that spirit, I want to introduce our good friend, Dr. Maurice Elias, who is the professor of psychology at the great Rutgers University. Not because it's my alma mater, it's because it's a great school, Rutgers University. Also the director of the Rutgers Social, Emotional, and Character Development Lab. Good to see you, Maurice.
Good to be here, Steve.
Maurice, I set this up by saying leadership in a lot of ways involves emotional intelligence, a term you're very familiar with. You've written about it along with Dr. Daniel Goleman, and the personal side of it, managing our emotions, keeping in check. Am I overestimating the importance of the emotional side of leadership?
I think in the crisis that we're facing now, you're underestimating the emotional side of leadership. People are close together, relationships are strained. We are trying to reach out to people over electronic media, and the emotions that are involved in this are very, very powerful. So no, I don't think it's overstating it at all.
So stay with me on this, because stress. I mean, it's such I'm not gonna say an overused word, because there is tremendous stress right now. Are there some keys to, quote, managing our stress during this pandemic?
We have to recognize our own feelings. And, that is not such an easy thing to do. That's one of the reasons why in my work, we find it so important for schools to attend to this issue, because when we're in a crisis, that is a hard time to learn how to manage your emotions. It's easier to learn these things when you're not in the middle of a crisis. But how can we make good decisions if we're not able to understand the stresses that we're under, understand the stresses that other people are under, our coworkers, our families? We have to manage all these things in a leadership context. And that, of course, involves stress. Now, one of the things I think that is so critical is that we have to be able to differentiate how we're feeling from how other people are feeling. And we have to be able to do that in a way that allows us to then process that to make decisions. I think that's the big leadership challenge, is that it's not just logic. It's logic plus emotions that helps to govern the decisions we make.
So, Mary, I want to jump in here because, Dr. Elias is talking about leadership in the workplace, leadership in your family. And one of the things I've said, and we'll talk about this throughout these programs, is this. It is hard to differentiate sometimes between our home life. I'm in my home. Maurice is in his home. Mary's in her home. Our production crew, everyone's in their home. So there's family life, there's home. Mary, jump in and talk to Dr. Elias and ask him what we've been talking about as it relates to our kids and managing the work and the family issues at the same time.
Yeah, I know for us, Steve, we have talked a lot because we have high school age children right now who are dealing with, my son in particular, not having a graduation, not having a prom.
A senior in
So
high school going to college in the fall.
definitely. So it really makes it challenging to communicate to them, okay, this, even though it seems really bad right now, it's not the end of the world. But for them, of course, they've been going to school for so long that they look forward to having that celebration at the end. So we've been working a lot and just talking about managing expectations, making the best of a really bad situation. But I would love to get your feedback because a lot of the communication coming from the administrators at the school are saying we really don't know what's going to be happening with the prom. They know it's postponed. They don't know what's going to be happening with graduation. We know it's postponed. So, what should educators and people tell parents and children when they really don't know, but also help to ease some of that stress and uncertainty that we all have?
And we've got to treat our kids as partners in this. And I think we have to help them understand that whatever age they are, what is going on here? They need to understand, what is an infectious disease? How does that work? Why are we engaging in these cautious practices? People think that people are being overly alarmist about this, but it's important that at every age that our kids understand. And because it's not like we're trying to make them feel better because we deprive them of something. These are life-threatening issues. And if our kids don't really understand it, then we're kind of trying to put like an emotional Band-Aid on them. But that in a way is disrespecting them. Their disappointment is deep and tremendous, and we can't push that away.
Right. And what about on the flip side, though, Maurice, when it comes to the parents who have young, say, first, second, third grade, they're balancing work, they're balancing literally teaching their kids how to read. What recommendations and advice do you have for those parents? Because those are a totally different set of stresses that they have of trying to give their attention to work, give their attention to their children. What advice do you have for them?
Most important thing to do is to set up routines and to be very transparent about the fact that everything is a work in progress. We're going to try this, we're going to try that. But I think it is critically important for kids to have routines, to know how the day is going to go, to know, for example, when mom or dad is going to be in the workplace, i.e. in a room behind that door that you're not going to be able to enter for X amount of time, and why that is. And helping kids then to have things to do during that time, et cetera. Now, it's not going to be perfect.
Right.
You're not going to be able to keep, a toddler from coming into your office space or knocking on the door or something. But we all understand that. And so we have to be compassionate and understanding toward our kids, but also give them structure. Structure and predictability, even in a time of uncertainty, is the best way to manage stress in a long-term situation.
Dr. Elias, in the limited time we have, I want to ask you this. Mary and I talk a lot about emotional intelligence. First of all, where does the term come from? And B, how do you define it in a very practical as opposed to a scholarly or academic perspective, which a lot of us would struggle with accessing?
Yeah, it's interesting because you talk a lot about leadership. We talk about leadership. So emotional intelligence are the skills of everydayship. They are the skills you need to manage every day. And what is that? To know how the people around you are feeling. To know when you've got very strong feelings, how to get a handle on them. To have a sense of empathy. To be able to be compassionate. To be able to work well in groups, but also by yourself. To know when to lead, when to go back. And to be a good problem solver, because isn't that the skill that we all need right now? We need to know how to solve these problems, which keep changing in front of us day by day. And these are skills that kids need to be taught. Just like we need to teach reading, even though every kid has an innate ability to read. We still have to teach reading. We still have to help kids learn the skills of emotional intelligence. Now, the challenges of life, who would have predicted this one? Who knows what the next one is going to be? But our ability to relate to each other, our ability to solve problems, our ability to deal with strong emotions, that is never going to change in its importance. And schools will benefit from equipping kids with these competencies.
Dr. Maurice Elias, a mentor of mine, a mentor to many. at Rutgers University, doing important work, professor of psychology, also director of the Rutgers Social, Emotional, and Character Development Lab. Our good friend Maurice Elias, thank you for joining us, and all the best to you and your family.
Great pleasure, and the same to you.
To see more one-on-one with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato PhD, and follow us on Twitter at Steve Adubato. One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Turl Fund, supporting Right from the Start NJ, the Robert Wood Johnson Foundation, Horizon Blue Cross Blue Shield of New Jersey, TD Bank, Summit City MD, the Healthcare Foundation of New Jersey, New Jersey Sharing Network, Gibbons PC, and by the Fidelco Group. Promotional support provided by ROINJ and by the New Jersey Business and Industry Association. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.
Hi, I'm Cecilia Zalkin. It costs much more to care for an infant than for an older child, and many New Jersey child care centers don't have the funding they need. Because of this, many children in New Jersey don't have their basic needs met. Right from the Start NJ is dedicated to supporting this vulnerable population, children from birth to age 3. We know that the early years are the most critical, and we believe that every child deserves a bright beginning and a healthy future.